Welcome back, strangers. Have you ever experienced a hallucination, heard strange voices inside your head, or did something because something unknown told you to? It is estimated that 5% to 19% of the population have experienced hearing others' voices inside their heads. Some are caused by mental health issues, but others can be caused by physical problems occurring inside the brain. In 1984, a previously healthy woman began hearing voices in her head telling her to have a brain scan for a brain tumor in one of the strangest medical cases. This case was published in a 1997 issue of the British Medical Journal about a woman referred to as AB, or Abby as we'll call her. She was born in continental Europe in the 1940s and moved to Britain in the 1960s, where she was a housewife and a mother. She had never been to a hospital for medical treatment, and her children were always in good health. One winter afternoon, she was at home reading a book when she heard a strange but distinct voice in her head. The voice said, "Please, don't be afraid. I know it must be shocking for you to hear me speaking to you like this, but this is the easiest way I could think of. My friend and I used to work at the Children's Hospital on Great Ormond Street, and we would like to help you." Abby was in shock and dismissed the voice as a strange daydream. However, the strange voices kept returning. They told her she was physically ill and needed to get help soon before it was too late. Abby was frightened by the voice and visited her family doctor, who referred her to psychiatrist Dr. Azuone. He examined her and determined that there was no medical explanation for what she was hearing and diagnosed her with functional hallucinatory psychosis. Abby was treated with thiarizidine and counseling, and the voices disappeared for a few weeks. With the voices gone, Abby and her family went on vacation to de-stress after her recent health scare. Yet the voices returned and told Abby that she must return to England immediately for treatment. She listened and returned to London to see Dr. Azuone again, because he was beginning to trust the voices. The voices once told her, "To help you see that we are sincere, we would like you to check the following." They told her 3 separate pieces of information that she had no prior knowledge of, but upon checking the information out, she discovered everything the voices had told her was true. She began to have increasingly more delusional thoughts and hallucinations. The voices gave her a specific address of a large London hospital. They told her she needed to go there and ask for a brain scan because her brainstem was now inflamed from the tumor. She was running out of time. Abby's initial request for a brain scan were turned down because of the lack of evidence and anything physically wrong with her. Dr. Azuone continued to request and negotiate with the hospital to perform a brain scan to see if there was anything physically wrong with her causing these strange voices. The scan was finally approved and performed the following month. More scans were ordered when the first did show signs of a mass in Abby's head. Luckily, the doctors believed a safe operation could be performed to remove it before it grew any larger. Abby underwent surgery in the following weeks, and the doctor successfully removed the entire tumor that had been growing on her brain. When Abby was in the recovery room afterwards, she reported hearing the strange voices one last time saying, "We are pleased to have helped you. Goodbye." Abby made an amazing recovery and did not require any additional treatment or medication. It is well known that lesions on the brain can cause psychiatric symptoms, but this was the first documented case of hallucinatory voices successfully diagnosing a patient, comforting them, and encouraging them to seek a specific treatment. Today, medical experts are divided on what actually happened in Abby's case. Skeptics argue that she may have subconsciously felt that something was off in her head. Her subconscious created the hallucinations to ensure she would seek medical treatment. Others believe the tumor size should not have had an effect on her until it grew larger, suggesting that something unexplained may have occurred inside of her head. What do you think, strangers? Did something unexplained happen that allowed a tumor to tell Abby of its existence and how to treat it? Or was it simply because of her subconscious mind that she got the help she needed? Let us know in the comments below. And until then, stay strange.